regarding AIDS and AIDS infections. We've invited 3 groups to be represented here today. We have our medical officials, the concerned citizens, and government officials. Before we begin our discussion, we'd like members of each group to introduce themselves. Why don't we start with government officials?
Kate Buskus,
Julia Zalika,
Tupa Basu,
Faith Allegra Lancaster Coleman,
Roger Perry Stowe,
James Green Armitage.
Thank you, government officials. Our second group are medical experts, medical researchers, and medical officials. Would you introduce yourselves, please?
I'm Dr. Luke C.D. Stein, medical doctor, PhD in virology, and I have a major in public consultations.
Caroline Nelson, Dr. MD.
Rayfield Posner, MD, PhD, Cornell University.
Dr. Zachary Curtis, MD, PhD, Harvard University.
Dr. Dina Manrich, MD, PhD.
Dr. Dawn Michelle Page, DMD.
Dr. Jason DeJesus, MD.
Thank you. And our last group, concerned citizens.
Daniel Wellington.
Megan Moyle, Beverly Scott,
Caitlin Hall. Jared Johnson, concerned citizen.
Danny Sandramone.
Thank you very much. There are 3 questions we'll be asking today which we'd like you to address for us. Are you prepared to begin to answer these questions? Okay, let's begin. The first question that I'd like to ask you is in reference to the actual spread of the HIV virus. You've all had to deal with situations, government officials in making policies, concerned citizens with dealing with these issues in your lives, medical officials with dealing with the disease daily. I'd like to ask you this: how do you think we can prevent the spread of the disease as we enter the 1990s? Who would like to take that? Yes? Kate.
One possibility is to require parents and teachers always to have condoms readily available for their children or students in high schools and colleges.
This may be an invasion of privacy, but I think it's much better than getting the HIV virus.
I think it's
What is much better than getting? What do you propose?
I agree with what Kate was saying, that we should give condoms out to high school children. Because and they may think, and the concerned citizens may think, that this is an invasion of privacy, but I think that is a better choice than getting AIDS.
Somebody from the concerned citizens panel. Megan?
Well, I'm not saying that giving condoms to high school students is an invasion of privacy, but for a high school student to go up to a teacher or a principal and ask them for a condom I would think that would make them feel rather embarrassed, and they wouldn't want to do that.
Member of the medical panel, Dr. Wilson.
Okay. Well, I have two things that might help. I think that in Michigan, just like Michigan, they have a disclosure law, which means that if you know that you're HIV positive, you have to inform the person who you're about to have intercourse with beforehand so that they can make the decision. And also, I think that instead of HIV positive patients going to any kind of dentist or doctor, whatever, I think that there should be special doctors that they should go to, like a bunch of them, that have sterile enough equipment so that when they treat another patient, they don't have to have any kind of fear that they might be giving another patient what one patient already has.
I'd like to actually pick, there's 2 things that I seem to hear running here. The one idea that perhaps a way of spreading the disease is to release condoms to the public, especially to teenagers. The other thing I'm hearing is disclosure laws, like Dr. Wilson just described. I'd like other members of the panel to please address those 2 issues, the issue of condoms and the issues of the disclosure law. Let's have a member of government officials. Take a look.
Think about the issue of handing out condoms. If people are very concerned about their children and about themselves, we should have communities should have organizations that spread information about the HIV infection and that give out condoms without the latex condoms that don't tear, and that without having to spend more money and without having to spend an extreme amount of money for the government to hand out condoms in schools, that the parents should organize, have an organization within their schools and within their community that hand out these condoms and that have videotapes and things like that.
So you're saying the community itself should be responsible for the distribution
Yes.
of condoms as a way of preventing AIDS. Dr. Stein.
I agree with Megan Boyle from Concerned Citizens that teenagers and young adults might feel embarrassed, and I think that schools and or communities, clubs, groups, organizations ought to strive to try to make teenagers and young adults feel the least embarrassed as possible, because I think that might be a constraint that might act as a reason for teenagers and young adults not to use condoms.
Thank you. Concerned Citizens Group.
Well, I feel that if a kid was going to use condoms, they buy them themselves. So if you distribute them, there's no reason that can say that those kids are actually going to use the condoms. There's got to be some other way that we know of to make sure that the kids are having safe sex and using sterilized needles and stuff.
I'm hearing from several of you that you feel that condoms, from all three groups, that condoms are a possible solution for preventing the spread of AIDS and distributing them to the public. Is there anybody on these panels who is opposed to that, as a distribution of condoms to teenagers and young adults? Yes, Dr. Curtis.
Well, I think that I don't approve of schools distributing condoms. I think that it's really the child's own business. I think because I would think that they would feel embarrassed just taking a condom from someone distributing something at school. I think they should take it into their own hands and go to a drugstore or buy a condom there.
James, as with government officials.
Well, I think that this is an unsure way of preventing the spread because you can't be sure that these people are getting condoms.
Thank you. Caitlin, from Concerned Citizens Group.